You just heard the words that no parent wants to hear, and that is that their baby has been diagnosed with HIE. As you try to process what this means, one question might rise above the rest, and that is whether your baby is going to develop a cerebral palsy diagnosis. The connection between HIE and cerebral palsy is a question that weighs heavily on the minds of many parents. And in today's video, I want to give you a clear understanding of how these two conditions, how they can be related sometimes, and why an HIE diagnosis does not automatically mean that your child will go on to have a CP diagnosis. I'm Marcus Boston. I'm a birth injury lawyer, and I've worked with families whose babies have suffered HIE brain injuries at birth. So I've seen firsthand the concerns and the fears that come with this type of diagnosis. And one of the biggest ones is whether a CP diagnosis will follow. Today I'm here to give you some answers so you can better understand your baby's situation and what steps that you might be able to take in the future with everything. HIE, or Hypoxic-Ischemic Encephalopathy, is a type of brain injury that is caused in our context when there is a deprivation of blood and oxygen during labor and delivery. Cerebral palsy, on the other hand, is a type of neurological disorder that affects movement, muscle tone, and posture, things like that. While HIE can be, a cause of CP, not every baby that is diagnosed with HIE will develop CP. The severity of the HIE injury plays a significant role in determining the risk for CP. And in some cases, timely medical intervention can reduce the likelihood of long-term issues like CP. So let's look and let's break this down further. When a baby's brain is deprived of oxygen, the amount of damage depends on factors like how long was the brain deprived of oxygen and how quickly did the doctors act. That's why some babies with mild HIE, they can recover with sometimes no lasting injuries, while others with more severe cases, they may go on to develop CP or have other developmental challenges. So what should you be looking for if you're concerned about CP? Early signs can include delays like reaching key milestones like sitting up or crawling or walking. Some babies might have muscle stiffness or weakness or trouble coordinating their movements. These signs, they might not show up immediately, but if you do notice them, it's important to talk with your doctors as soon as possible. Now, many babies that are diagnosed with HIE, they can undergo a treatment called therapeutic hypothermia or cooling therapy. This is a type of treatment that's aimed at reducing the brain damage by lowering the baby's body temperature for a period of time. Now, while cooling is not a guarantee that CP won't develop, it has been shown to improve the outcomes for many babies with HIE by minimizing the extent of the brain injury. Beyond that, early intervention programs like physical therapy and speech therapy, they can make a huge difference for babies who do go on to show signs of CP. The sooner the therapy starts, the more support your baby will have in achieving their full potential. Getting an early diagnosis is key. If your baby does show signs of CP, getting into early intervention programs can help them build the skills and work around their challenges. These programs will focus on improving like motor skills, speech, and social interactions, giving your baby the best chance at a higher quality of life. When it comes to an HIE injury, the next step is often understanding how did it happen? Could the HIE injury, could it have been prevented? And possibly a CP diagnosis have been avoided. A thorough investigation can help answer some of those questions. Were there delays in monitoring your baby's distress during labor? Was there a failure to act quickly enough when things were going wrong? These are important questions that a birth injury lawyer like myself that we will explore. When HIE leads to CP, it can significantly change a family's future, and it's essential to make sure that you have the resources and the support that you need for your child's care now and into the future. Again, I'm Marcus Boston. If you have more questions about your baby's HIE brain injury at birth from a medical legal standpoint, don't hesitate to contact me. You can find out more information about me, how to contact me, my bio, my history, and all of that type of stuff in my profile. All right, that's going to be it for today's quick educational video. Have a great day, everybody.